At this point, I'm going to turn it over to my partner in crime, Teresa Miceli. Hopefully you all know Teresa. One of the great things we did at the IMF was to recruit her to work with us, as she also continues to work at Mayo Clinic in Rochester. So we were Mayo buddies at one point when I used to work at Mayo Clinic in Arizona. And she's going to talk to us a little bit about shared decision making. So TM, I'll turn it to you, boss.
Thank you. I don't want anyone to think that I'm stalking him, but it is a pleasure to work with him in this capacity as well as at Mayo Clinic. So for those of you who don't know me, I am Teresa Miceli. I'm a registered nurse. I have had the opportunity to work in the myeloma space since 1991. Yes, I was about 3 years old when I started. And so at that time, I was working in stem cell transplant. I was recruited or invited to be part of the Nurse Leadership Board with the International Myeloma Foundation, which was started in 2006, and you'll hear from one of my colleagues tomorrow, Tiffany Richards, on symptom management, and we do a lot of work with educating patients and other healthcare providers, because as many of you know, myeloma is not that common of a diagnosis, and we'll go over that later today with Dr. Joe and myself during our Myeloma 101 conversation. But I did, with open arms, join the IMF as an advisor to their info line. So if you call in, you'll hear from Paul, Missy, or myself. And if you have questions, please let us know. We're happy to take your questions. And if we don't have the answer, we're going to find the answer, or we'll make one up, but that's not usually the case. My work in myeloma has, if nothing else, told me how important it is that patients and care partners be a part of the decision-making that goes on with them, for them, when it's related to their treatment. And that's the topic that's near and dear to my heart, and we'll be talking about right now. I want to really go over what shared decision-making is. What are some of the influencing factors? And as Yelik says, want to empower you, provide some strategies for how you can be a better part, a greater part of decision-making when it comes to your health care. You will be hearing a lot today, and tomorrow, as Dr. Joe said, about the treatment schema, the treatment landscape, and how we approach myeloma care. What's always important for us to remember is that we are treating a person with myeloma, a family with myeloma, that has commitments to other parts of their life, not just myeloma. That you have family, that you have jobs, social responsibilities. Yes, we want to manage the myeloma and make sure the symptoms are cared for, but you as an individual need to be taken into consideration, and that's only going to happen if you're part of that decision-making team. So what is shared decision-making? This is not a new term. This is a term that's actually been around since the 1970s. It's really all about understanding that there's a decision that needs to be made, and patients understanding the risks and the benefits, or the pros and the cons, of what happens with those treatment options and the decisions that are made, and making sure that your goals, your preferences, are included with all of that decision making. There are steps in this process, and I like to use a similar analogy to going out to dinner. That may seem simple, but yet when we break it down into the simplest terms, making a decision is first part of, knowing a decision needs to be made. So I get to LA yesterday, and you might have noticed I'm from Minnesota. Yep, you can hear it, right? I get to LA and I want to go out to dinner. Couple of options, right? Well, before I got here, I started Googling what might be a good option for going to dinner. But I needed to rely on my LA colleagues to help me decide. And they're like, we could go to Chinese, we could go have, Indian food. I'm like, you know what, I hate curry. I know that's wrong for me to say, but I do. And so they started offering some options, and I eliminated some of those based on what my preferences were. I'm like, I don't want to go to the burger joint. I don't need any more fatty foods. Well, you might notice that just down the street, or a few blocks away, probably 200 feet, and took about 20 minutes. That's about right in LA? 200, yeah. There's a little place called Miceli's Italiano Ristorante. Okay, so we had to go there because that's my last name. I figured I might know somebody that was there. I didn't, but it was still fun. It was a good experience. But even in that decision-making, needed to have the information being brought in. We needed to make a decision, needed to understand what my options were and what my preferences were when it came to making that final decision. We did end up going there. We had a good experience, kind of reviewing it all. It's like, well, maybe I wouldn't go back just for the food. It wasn't that great. Don't tell them I said that. But that's all part of that shared decision-making. And myeloma is a much more complex topic than that. But when you break it down into the basics, it's kind of the same thing. What are the does a decision need to be made? Are we at a point where we need to make a decision, a choice in treatment, a change in treatment? We're leaning on your healthcare team so that you understand what those options are, what the risks, the benefits, the pros, the cons are, but your healthcare team needs to know how it's going to impact you, what your preferences are. Coming together to come to a decision that best fits not only what we need to do with myeloma, but your preferences, and then continuing to evaluate how things are going. Follow-up visits, deciding, is this still the right track? There are advantages that go with this. As you can tell, I'm very passionate about this, but really key to this is that it requires you as a participant to stay informed. And so I applaud all of you for being here, being a part of this education session, and continuing this education journey while you're continuing the myeloma journey. It helps to alleviate some of the fear that goes with that uncertainty if you don't really understand what is happening. The decisions being made are more likely to reflect your own personal preferences if you are a part of it, if you are truly having this conversation. And overall, it does impact quality of life. If you are part of the decision making, if your preferences are being involved, this is undoubtedly going to impact your quality of life. Dr. Terpos, who is a member of the International Myeloma Working Group, I think he states this really well, is that efficacy to each person means something different. What's important to me is not necessarily important to you, right? And so taking each individual's considerations, preferences into thought really does constitute the best treatment choice. So there's some things that also influence our ability to make the choices that we want. In an ideal world, well, in an ideal world, we wouldn't have myeloma, but we do. And so what influences whether we can make the most optimal choice for us? Sometimes it's the diagnosis itself. For those of you who were sort of urgently diagnosed, maybe you went to the emergency room or were admitted to the hospital, there was sort of this urgent need to get treatment started. We didn't have a lot of time to linger and think about it. However, for some people who maybe are transitioning from a smoldering state into an active state that requires treatment, there can be a little bit more time to gather that information, really think about the choices and the options that are available. And that's also true when it comes to a relapse process. Some people have what we call biochemical versus a very fulminant relapse, and we'll go over that a little bit more in a couple hours. There's also, even in our country, the challenge of, do we have access? Whether it be financial issues related to having access to drugs, or maybe, somebody would say, I would want CAR T first thing, right away. I did say CAR T right away in my talk, okay. But it's not available until second or third line, and that was only a few weeks ago that was approved. You couldn't get it until after 4 lines of therapy. That's true with our bispecific therapies. So sometimes it's about access to the actual therapies that we want. This is a very complex diagnosis, and as a patient, you do need to stay up to speed on what's going on so that you can be a part of that decision making. Maybe you don't feel good, especially when you're first diagnosed or you're relapsing, and you just don't have the mental and physical energy to really be as much a part of that conversation as you would like to be. There is still that sort of patriarchal healthcare doctor-patient relationship that goes on, where patients don't always want to question what their doctor is telling them or saying. I was speaking with somebody on the info line who's like, you know what, I really don't want to go to this particular drug because I know about the side effects, but that's the one my doctor is encouraging me and kind of pushing me to go with. And I commended her for saying, providing her rationale and giving the understanding based on her preferences why that was not the best option for her. When it comes to our providers, they would like to spend as much time as they possibly could going on about everything myeloma they can. But believe it or not, there's somebody that they're going to be seeing right after you. And even though you've already waited 20 minutes, that person's going to wait 30 minutes. And so there are time limitations to being able to have this very robust, detailed conversation. And we'll talk a little bit about, being prepared for a medical visit. And sometimes that also means sending your portal questions ahead of your visit so that they are on record, and sometimes you forget when you get there, or maybe the most prioritized questions need to be sent for some consideration. So there are a variety of things that can influence whether that treatment decision process really goes in the best of flow as we would like. So some strategies for this concept of empowering you and helping you to be a better part of patient treatment decision-making is, like I said, staying informed. And you'll see outside that there are a variety of publications available that you can take this weekend, but you can also get more of them at myeloma.org. You can order them online. We can have them mailed to you. They're all free of charge. I encourage you to take what you need for now as well as what you might be thinking of for the next step in your treatment process. There are a variety of webinars that have been recorded, and they're available on myeloma.org. And of course, the info line. I will continue to plug the info line. The other part of this is not just gathering knowledge, but really doing some soul searching. What are your preferences? What are your priorities in life? I was working with a gentleman who is a guitar player, and he was very, very concerned about receiving bortezomib, which is known for causing neuropathy. And so we really had a very long conversation about that treatment approach, how this was considered to be part of standard of care for frontline therapy. We could give it a try and see how it was doing and if there were any side effects he was experiencing, and then we could make a change in his plan. And so again, those personal preferences, diving deep into what you are thinking is a priority. Maybe you're ready to go to a stem cell transplant, but you have a wedding next month that you really want to look like you in those photos. Daughters getting married, whatever it might be. Talk to your healthcare team about the timing of those sort of things. Be a part of the conversation, ask the questions, maybe discuss it ahead of time with you and your care partner so that you can really refine what those questions are. Come to a treatment decision, again, together based on what your preferences are. We can always adjust it. We can review, see how things are going, and make a change if needed. It's all about coming together with a treatment decision that works best for you and against your myeloma. So if I were to ask you, who is your healthcare team? Well, I think it might be pretty easy to start out and say, well, I got my primary care doctor. They're the ones who sort of were concerned about this being myeloma and helped me get diagnosed. I went and met with a general hematologist, and he got me started on treatment, but really strongly recommended that I see a myeloma specialist, like Dr. Joe. And so these are some key components or key members of your healthcare team. If we add to that, we have maybe your kidney doctor or your bone doctor or your endocrinologist who's managing your diabetes now that you're on Dex. You have your nursing staff, your nurse practitioners, allied health, pharmacists. You've got your social network, your spiritual network, all of these people that are part of your healthcare team. Who haven't we identified yet in this healthcare team? The patient, absolutely. Central to all of this. You become the hub to all the spokes that makes this wheel move forward. And it's important to understand what the roles are for all of these individuals in your healthcare team. And the reason is you don't want to go to your primary care doctor and say, you know what, I think it's time for a new myeloma therapy. What do you recommend? That's not going to fly very well. Just as you don't want to be going to your hematologist and saying, so what do you want to do about my blood pressure? You really want to kind of balance that out so that you are optimizing your time with each provider in the way that is going to be best on your overall healthcare plan. Make sure that you're seeing primary care to do all those healthcare screenings, those survivorship tests. Make sure that you're seeing your subspecialists for specialty needs. And keep a contact list of all these people. And I also recommend that you do a little journaling of, what treatments have you had? When did you get them? What were you feeling like when you were on those therapies? In the event that the discussion comes up somewhere else that you need to know, ooh, that's right, that medication really made me feel pretty lousy. I'm not sure that I want to do that again. Be prepared for your healthcare visits when you're going to see your doctor. Get your medications in order ahead of time, write down those questions, send them through the portal. If you have paperwork that needs to be completed for you or a family member, make sure you have those prepared and bring them to the visit. When you're there, provide them with the updates, good, bad, and ugly, whatever it may be. What's going on with you, your myeloma, your family? It's not just about your myeloma, it's about all that's going on with you. Are you having symptoms? Have they changed, better or worse? What's made them better or worse? Making sure that you're prioritizing your questions and effectively communicating with your team to get that information in during your visit. Making sure that you're also knowing what the follow-up plan is when you are done with your visit. Are you coming back in 3 months, 1 month? Are you having blood work? Are we going to be doing a bone marrow biopsy? And making sure that you have a care provider with you, a care partner, so that at those pivotal visits when you may be making some decisions or changes in your plan. Think about if there is a telehealth option or telemed option. You want to prepare in the same way, but you also want to think about your surroundings during that visit as far as, are you going to have to show a body part? You want to be in a discreet place to do that, or wear clothing that you can show a rash or a new mole or something that might be coming up. You don't want to be in a car or in a public place for those visits. Know if you need to have blood work drawn ahead of time before that actual video visit so that the doctors have something with lab results to look at. And as I mentioned, care partners are really important, and it's not just a care partner, but developing a care network. And what I mean by that is you may have your spouse or significant other sitting by your side and available to you on a regular basis. There are some people who don't. They live alone. That solo and strong support group would be a good option for them. But we need to think about more hands make lighter work, okay? And so having a care network allows for people to use their skills, their strengths to help you out. It doesn't even have to be somebody who's here in person. It could be somebody who's helping from a distance, even hired help like ordering groceries and having them delivered, a service to mow your lawn if you're not able to push the mower or ride the mower. So thinking about the variety of options available to expand your care network, because we do know that myeloma really does carry the largest burden of symptoms of really any diagnosis when it comes to blood cancer disorders. So as you go through the next couple of days, and I really want to set up that we are wanting you to be thinking about what are the changes that you may be needing to decide on. What decisions are coming your way as far as your treatment goes? What are the options? What are your preferences? That really does take a little bit of soul searching. Think about what's important to you. Create questions that will lead to better understanding. What more do I need to know? What am I not asking that I should be asking? And become truly an active member of your team and the decision-making process.